All right, let's talk a little bit about synovial joints. Now, synovial joints means with egg. That's what syn with ovia, like ovum, egg with egg. That's what that word means. There's a reason for that. When we look at just a generic synovial joint, you're going to have two bones. That's why we call it diarthrotic joints. So here's one bone, and here is a second bone. Kind of like a lock and key mechanism. One's going to fit inside the other just fine. They can be a little bit more shallow. They can be a little bit more round. That's fine. This is a generic joint, just long enough for us to be able to draw this. At the end of each of these long bones, we're going to find a plate of hyaline cartilage. And I'm going to label this in just a second, but I want you to be able to see the parts that we're drawing first. Well, this plate of hyaline cartilage is going to resist any type of compression between the two joints. Now, when you're looking at somebody's finger, there's not a whole lot of space there. I'm exaggerating this so that we can draw. This is going to be the anterior. This is going to be the posterior portion of the joint. There's an eye there. There we go. Well, when we're looking at synovial joints, we've got this dense, irregular connective tissue that is going to surround the joint and create a joint capsule. It's going to create a joint capsule. It's continuous with the periosteum. Peri means to go around, osteum means bone. So it's going to go around the bone. Now we've got this joint capsule. Inside this joint capsule, we're going to have this tissue that secretes synovium, which is the fluid that keeps these joints apart. It creates a space here called a joint space. It's going to be filled with synovium, or synovial fluid. There we go. So we have our joint capsule. It's a dense, irregular connective tissue. It's going to keep this joint apart, and that sounds weird because it looks like it's holding it together, and it is. It's holding the joint together for joint integrity. However, there is a reason why we have this freely movable joint. This joint space is full of a fluid. You can't compress a fluid. So the forces that are being pushed down to compress these joints together are pushing on this fluid. Well, that fluid wants to leave because fluid likes to move to the path of least resistance, but then it reaches this joint capsule. So that joint capsule pushes back and readdresses those forces in equal and opposite directions. It maintains that joint space by pushing on this capsule. The hyaline cartilage, just in case those joint spaces ever do hit, let's just say you jammed your finger, that hyaline cartilage should be able to resist most of that compression and then bring it back out. So we have our two bones, we have our articular cartilage, and then we've got our synovial membrane. This is called the synovial membrane. Inside here, we don't really have a good healthy blood supply, but going through that joint capsule to the synovial membrane, there's a very high amount of blood vessels that are going through that. That means that you can get nutrients. So the synovial sites are taking nutrients into the joint, and it's taking wastes out. Well, those wastes could be things like metabolic breakdown, those wastes could be things like dead cells, and so on. So we bring nutrients in, take wastes out. The way that we get this to work the best is by moving them. You got to move these joints. Movement is life. Okay? To really put more of a fine point on there, and to borrow from somebody else, an object in motion stays in motion. Keep those joints moving so that they stay healthy. We're also going to have some ligaments that go along with this. Ligaments hold bone to bone. Bone to bone. Ligaments, bone to bone. We call them accessory ligaments because they're going to go along with this and accessory to the rest of the joint space. So they can be things such as the ACL and PCL. Cruciate ligaments. They cross the joint. Cruciate ligaments. So ACL, anterior cruciate ligament. The posterior, of course. Then we have our MCL and LCL. Okay, so we have the medial, collateral ligament, and the lateral collateral ligament. Those are going to come out of the page, and they're going to sit right here on top, one way or the other. So I'm going to draw that on a different picture for you. It's the same joint, so give me just a second to do so. Same basic joint. Everything else is the same. Nothing's changed. Except rather than being A to P, this is going to be something like the patient's right and the patient's left. So here is our capsule. Joint space and cartilage, of course. And then going along right here, we've got our medial and lateral collateral ligaments. So let's just say if this is going to be the right part of the knee, because you've got two knees, both of them have a right and both of them have a left, we're going to associate this with the right knee. So we say this is the right knee, and this is going to be the right side of the right knee. Then that would make this the right and left collateral ligaments. Well, if this is the right knee and you're looking at the right side, this ligament right here, this accessory ligament, is going to be the lateral collateral ligament. If this is the right knee and this is the left side of the right knee, that would make this the medial collateral ligament. Again, the forces pushing down, trying to make you stand up against gravity, are going to try to compress that fluid, which pushes out on the joint capsule. Joint capsules are then going to push back in, resisting those forces, standing you upright against gravity. Those medial and lateral collateral ligaments help maintain joint integrity. We call it anatomical integrity. So maintain joint integrity. ACL and PCL are also going to do the same thing, resisting axial translation. These hold them together, allowing them to bend, of course, because this is a freely movable joint. It can move left, right, up, down, forward, and back just a little bit, in all three planes, just a little bit. We don't want to go too far, too fast, because that can lead to something like an ACL tear or a PCL tear. Or you can damage one of the collateral ligaments, of course, or you can jam it all together and damage some of that articular cartilage. Okay? In the knee, we also have another type of cartilage sitting on one side and the other of the tibia, in this case, as compared to the femur. We have something that's called a meniscus. A meniscus is made out of fibrocartilage as compared to the hyaline cartilage here. So if you've ever heard of a meniscal tear or meniscus tear, we're talking about the fibrocartilaginous discs that we find here. Okay? It's just a more dense type, more resistant type of cartilage than is hyaline. Hopefully you've learned something from this. Put in your messages. I'll be happy to answer any questions you've got. Have a great day.